Testosterone Replacement Therapy, or TRT, was previously the most common treatment for low testosterone. But TRT is associated with a number of side effects and is often a long-term commitment because TRT shuts down and synthetically replaces your body's ability to produce its own testosterone. However, transitioning from TRT to a more natural treatment like Enclomiphene allows you to experience the benefits of increased testosterone without most of these side effects. Let's walk through how. Now, before we get to the how, let's look at why countless men have transitioned from TRT to the Maximus King protocol. The most common side effects associated with TRT are as follows: testicular shutdown and shrinkage, decreased sperm count and infertility, tired of injecting themselves regularly, feeling off when testosterone is too high near the time of injection and testosterone being too low before their next injection, tired of having to donate blood regularly due to excess red blood cells, worsened sleep apnea and fatigue, mood dysregulation and anxiety, high blood pressure, and excess estrogen and gynecomastia or man boobs. So as you can see, despite the benefits, there are a lot of short-term and long-term adverse effects that may dissuade users from continuing to use TRT. So now that we've discussed the why, let's talk about how to transition from TRT to Enclomiphene. Once you're on TRT, you should always consult with your prescribing provider about how to come off of it. If you're on a higher dose, they may suggest tapering off of it to avoid feeling as bad. It is possible to experience side effects such as low libido, low energy, irritability, and depression as your testosterone levels plummet. But the likelihood and intensity of these symptoms depends on how strong and how long you've been on treatment. However, many men can just discontinue TRT under doctor's supervision, as longer acting forms of testosterone slowly leave your body on its own, providing a bit of a natural taper. Before you begin treatment at Maximus, it's important to have a clean baseline lab test that shows what your natural level of testosterone is without exogenous or synthetic testosterone in your system. Thus, we require prospective patients to discontinue TRT for at least 2 weeks prior to taking our lab tests in order to have valid results. If you don't do this, and your lab results are supraphysiological or artificially elevated due to TRT, then you'll be disqualified from treatment until you test again and come back within a normal range that clinically justifies treatment. After coming off TRT, you can make the transition to Enclomiphene, which will restore your natural testosterone levels in most cases. With Maximus, you'll work with a board-certified physician to come up with a custom treatment plan for you, and you'll also be tested before and after treatment to ensure that it's working. Now you're probably wondering, how long does it take after transitioning to see a restoration of normal testosterone levels? We retest patients 30 days after beginning treatment and every time you make a dosage adjustment to see where your testosterone levels end up. However, for TRT patients in particular, it can take at least 3 months to find the right dosage and restore your natural testosterone levels, and up to 9 months to restore testicular volume and spermatogenesis to restore normal testicular functioning and fertility. So say goodbye to painful injections or messy creams and common side effects associated with TRT, and say hello to natural testosterone produced by your own body, along with more muscle mass, sex drive and confidence, and more with Enclomiphene. So if you're interested in safely optimizing your testosterone levels, click the link in the description below to see if you qualify for treatment. And please be sure to like the video, hit that subscribe button, and click the notification bell to never miss a video from me on this channel.